let's open questions and comments from the audiences. Dr. Ueda, please.
Okay, thank you very much for comprehensive presentation. Especially the health part, the Dr. Jeronsky explained that the really important the work by WHO, and you mentioned about the the mobility issue, as the Dr. the Clemento Clemento I mentioned, and I want to ask about the about the mobility issue, because the based on my understanding, especially the you mentioned about the definition of the mobility. So the maybe the in Japan, the based on my experiences in Japan, mobility, the capturing the mobility is not a big issue, because we have some the disease registry and cohort studies, so the we can utilize that. But for the the maybe the my question is about what aspect are the big issues in the the using mobility.
Thank you. So one aspect is about the accessibility of the data from
Yes.
different countries. This is obvious, so I will not
Yeah,
discuss
obvious,
this.
Mm-hmm.
What colleagues have noticed when started collecting published studies is the inconsistency in reporting incidence or prevalence. Incidence, which is signals about new diseases. Prevalence is just how frequently they are in the population. And there is some confusion, and it's not possible to really pull together studies that look at the incidence and prevalence. So this was one of the observations which make, for example, completion of a systematic review and meta-analysis difficult. It's not so much about the very diagnosis, so the use of these ICD codes, but one aspect is incidence versus prevalence.
Yes.
And in this morbidity cluster, also conditions or parameters like, for example, these restricted activity days are considered. And when you look in depth, there are many issues with how to define it so that they are properly categorized and then serve the basis of analysis and contribute then to development of solidly based concentration response functions.
Oh, thank you very much. Yeah,
Welcome.
I agree with that, yeah, based on that, issue for, especially for that, yeah, instance and prevalence, the confusion about that is the one issue. Yeah, I agree with that. And the maybe the diagnosis differs by country, especially
also,
yeah, maybe the WHO's task is to combine that, the evidence from the different countries. So that is the really becomes really big issues. Maybe are there any standardization of the the diagnosis of the for the diagnosis of the the some specific diseases, or the some the maybe the guidelines for reporting the the health effects of air pollution, if you that if there is any such kind of that guidelines, that could you tell me?
Yeah. I think that you are pointing out to the very big issue, which is, I think, relevant not only for studies related to air pollution, but this comparability. And again, there are many aspects. One, there is this internationally agreed system of diagnosis, this ICD international system. But even if all countries are applying this, there are some differences which come from, I would say, certain professional culture, traditions, which are introducing some differences. But I mean, it's that now the time is very limited, but to make it very brief, you pointed out to a really important component, which is the appropriateness of identifying diagnosis and using the proper codes so that then these data are reliable. And there is a lot of work done in WHO, I would say in general, related to coding of diagnosis and capacity building in countries to improve it, because it's also important for other purposes. Thank you.
Thank you very much.
Thank you very much for very important question and answers. And one quick question from Dr. Sase. Please.
Yes, thank you, Dr. Yamashita. For Dr. Clement, I would like to ask you a simple technical or practical question on the conversation between the scientific community and the policy makers. In the case of Europe, the modeled results by the gains or some other approaches, how to authorize such a results in the as a network or in the policy makers, and then in which timing are you published the scientific papers? Before authorization of the results, you need to publish the research works in the international journals or simultaneously or something like this. Thank you.
Thank you very much. Thank you. This is a very good, very important question. This credibility of the modeling results, especially when we have so many different stakeholders and actors around the table with very varying interests, of course, is absolutely essential, and it has taken quite some time. If I might recall, at the very beginning of the work under the convention, there were 3 larger integrated assessment models that were used for the assessment simultaneously. Eventually, over time, it has evolved into a creation of the Center for Integrated Assessment Modeling, where the gains model is at the center of this, while the other models are used for national assessments as part of the validation also process and independent check. But at the same time, the Center for Integrated Assessment is one of the centers. I did not show the whole chart, but it's one of the centers closely collaborating with the other centers that address and expert groups that address issues about emissions, costs of control, and also the impacts of connecting to the work about critical loads or health impacts. And the model is then using that consensus information. This is the best available science information supported actually by local policy. So I see this as a process, and it has been successful both for the Air Convention as well as the European Union as a process of joint, open exchange. It's very important that all the information is available all the time. And the peer review process is running in a way in parallel. So it's not a must, but it's a very strong support, of course, for the whole discussion if both the modeling methodologies as well as the results for some of the key assessments are published in the peer literature. But one of the essential ingredients is really to keep everybody involved in this discussion. And the Air Convention has provided the whole network and built in a way the infrastructure to have this parallel system of working groups and modelers working together throughout the years. And this continuity is also extremely important. The European Union actually picked up on that model and continues doing it. Just a few months ago, we had a consultation process that was over 2 months with 27 EU countries. We have met for regular meetings with all single countries during a process of evaluating preparation of the Clean Air Outlook, a third Clean Air Outlook for Europe, which is a process of evaluating progress in achieving the national emission ceiling directive in the EU. And that's very similar to the discussion that we have in the Air Convention, where also there's a regular exchange, an open exchange. So that is an important ingredient of the successful application of these tools. Thank you.
Thank you very much for your information.
Thank you very much.